As we come to the end of our course, we begin to look and examine demographic transitions. The first demographic transition is mortality, which is the subject of lecture quiz number 27. What we are most going to focus on is this concept of demographic transitions, specifically what these transitions, what kind of impacts they have on populations, in particular the composition of populations. Policies are designed to influence the transitions. They play a crucial role in shaping demographic transitions. For instance, healthcare improvements, educational initiatives, and economic incentives can significantly influence mortality and other rates too. World population conferences are policy tools. These conferences have been instrumental in shaping global population policies. They provide a platform for countries to collaborate and address population changes. In particular, we will be focused on population policy in the 21st century to manage these with the goal of managing these transitions. In the modern era, managing demographic transitions involves addressing complex challenges such as aging populations, migration, and sustainable development. Formulating an effective population policy requires a clear understanding of the current demographic trends and expected outcomes. This simple visualization illustrates the goal of changing a population trend with an intervention, such as a global program focused on changing the mortality of pandemics, which we will explore. We know the expected demographic result based on the trend, but an intervention will derail that trend with the desired demographic result and consequences. Demographers and policymakers and stakeholders have often met on a global level to investigate these activities. The World Program is one of those. One such meeting was called the World Program of Action and proposed several measures to manage the mortality transition. Specifically, lowering infant, child, and maternal mortality by improving healthcare services and access, they identified that they could reduce mortality rates significantly. Also, another way to change mortality significantly would be to bring the AIDS pandemic under control. Effective management of AIDS is crucial. It is projected that the world would have 1 billion more people by mid-century if AIDS were able to be stopped. These measures are essential for ensuring a healthier global outcome. Basically, if you look at it as reductions in death, AIDS-related deaths have decreased by 69% since their peak in 2004 and by 51% since 2010, since the World Program of Action occurred. New infections, however, do still exist. They have been reduced by 60% since the peak in 1995, again due to the World Program of Action. In 2023, there are 1.3 million new infections compared to the 3.3 million in the 1999 population. Your first quiz question is, which of the following best describes the primary purpose of interventions aimed at managing the mortality transitions of the ones we have described today? To lower infant, child, and maternal mortality rates and control pandemics like AIDS. In fact, the AIDS epidemic has been 40 years of response. In the early 1980s, the first cases of AIDS were reported in the United States. In the 1990s, the epidemic peaked around mid-1990 with millions of new infections and deaths annually. In 2004, the AIDS deaths reached their peak approximately at 1.1 million. In 2010, deaths began to decline significantly due to widespread availability of antiretroviral therapy, or ART. By the way, the doctor who spearheaded this particular program was Dr. Anthony Fauci. that continued to decline. In around 2023, around 630,000 people died from AIDS-related illnesses, which compared to the millions of those who died in the late 80s and each year of the 80s and 90s, this is a significant increase. Excuse me, in better outcome, a significant decrease of death. Since the start of the epidemic, approximately 42.3 million people have died from AIDS-related illnesses here in the United States. Of course, AIDS is a pandemic. It does not occur just in the United States, although the first cases were reported in the US. Today, well, in 2023, I should say, North America, Western, and Central Europe only had 56,000 newly infected HIV adults and children. This is not the story for the rest of the world. In sub-Saharan Africa, the region most affected, with countries like Eswatini, Lesotho, and Botswana, have the highest HIV prevalence rates. In some countries, HIV and AIDS is the leading cause of death. In 2022, there were 19,000 deaths among adults and adolescents diagnosed with HIV. But the highest death rates of new diagnoses continue to occur in the South Global, with a Southern Global distribution, with the highest in Sub-Saharan Africa. Other regions like Southeast Asia and Eastern Europe also have significant numbers of people living with HIV. You'll note that the demographic transition theory also seems to have an association with those who are in different stages. Those countries in this stage 2 in the early transition experience high birth rates and declining death rates due to improvements in healthcare, but their HIV/AIDS mortality is significantly high. Stage 3 or the late transition countries like India and Brazil also have seen significant reduction in HIV/AIDS mortality, also due to better healthcare infrastructure and specifically the widespread use of art. The stage 4, like developed countries in Western Europe and North America, of course, they have the low birth and death rates, and HIV and AIDS is well managed due to advanced healthcare systems. The quiz question is, which region has the highest percentage of newly infected individuals with HIV? Sub-Saharan Africa. The United States has spent time and energy and created policies to affect AIDS. In particular, in 2003, PEPFAR was launched. PEPFAR stands for the President's Emergency Plan for AIDS Relief. It was a key USAID was a key implementer of PEPFAR, providing funding, technical assistance, and program implementation. PEPFAR has saved millions of lives, prevented millions of infections, and supported millions of orphaned and vulnerable children that are there because of AIDS. In the Global Fund, which PEPFAR encourages and participated in, has also joined the fight to end AIDS, tuberculosis, and malaria. USAID is or was the largest single donor to the Global Fund, which invests in programs to end all of those diseases, as well as other epidemics. The Global Fund has been instrumental in providing antiretroviral therapy to millions of people living with HIV/AIDS, and in particular, this has stopped the spread of AIDS or HIV positive from mother to child. The Global Fund, with partnering with USAID, has worked to strengthen health systems in partner countries, ensuring that they can effectively deliver these services. This includes training healthcare workers, improving supply chains for medications, and enhancing laboratory services. It's had many impacts and achievements, specifically the aimed reduction in AIDS-related deaths. The prevention and treatment, USAID has supported the distribution of millions of HIV tests, condoms, and of course those ART medications. Another of their impacts and achievements was community support. The The agency has also focused on community-based intervention, supporting local organizations to provide care and support to people living with HIV and AIDS. However, there are challenges and future directions for USAID. Currently, there have been some funding cuts. They have posed challenges to USAID's ability to maintain its programs at previous levels, and therefore sustainability is become a significant issue. Ensuring the sustainability of the HIV/AIDS programs in partner countries remains a key focus, with efforts to transition program management to local governments and organizations.